Hi, my name is Hoang Dong and I'm going to be talking about heroin. And this is all contents I will discuss today. According to National Institute on Drug Abuse, heroin is an opioid drug made from morphine, a natural substance taken from the seed pod of the various opium poppy plants found in Southeast and Southwest Asia, Mexico, and Colombia. Heroin can be a white or brown powder or black sticky substance known as the black tar heroin. Street names for heroin include BH, black tar, Chiva, hell dust, horse, negra, smack, or thunder. Heroin is usually used by injecting, smoked, or snorted. High purity heroin is usually snorted or smoked. Next, I'm going to talk about how does its effect on the body. About general effects, heroin enters the brain rapidly and binds to opioid receptors on cells located in many areas, especially those involving feelings of pain, pleasure, and in controlling heart rate, sleeping, and breathing. When someone ingests heroin, they often experience a rush from a drug reaching the brain so quickly. The general effects of using heroin include containment, reduced anxiety, relief tension, drowsiness, and apathy. About short-term effects, we have dry mouth, warm flushing of the skin, heavy feeling in the arms and legs, nausea and vomiting, severe itching, clouded mental functioning. Long-term effects including insomnia, collapsed veins for people who ingest the drug, damaged tissue inside the nose for people who sniff or snorted, infection of the heart lining and valves, constipation and stomach cramping, liver and kidney disease, lung complications, mental disorders such as depression and antisocial personality disorder, sexual dysfunction for men, and irregular menstrual cycles for women. Because heroin users do not know the actual strength of the drug or its true contents, they are at a high risk of the overdose or death. The effects of a heroin overdose are slow and shallow breathing, blue lips and fingernails, clammy skin, convulsions, coma, and positive death. Heroin is highly addictive. People who regularly use heroin often develop a tolerance, which means that they need higher and or more frequent doses of the drug to get the desired effects. A substance use disorder is when continued use of the drug causes issues such as health problems and failure to meet responsibilities such as work, school, or home. An SUD can rank from mild to severe, the most severe form being addiction. Other opioids such as oxycodone, Vicodin, codeine, morphine, methadone, and fentanyl can cause similar effects as heroin. Heroin is a Schedule I substance under the Controlled Substances Act, meaning that it has a high potential for abuse. No currently accepted medical use in treatment in the United States, and the lack of accepted safety for use under the medical supervision. This is because addiction, like any chronic disease, is defined by the potential to relapse to substance abuse. Rates of addiction relapse are similar to those associated with asthma, hypertension, and diabetes. Because treatment for addiction to heroin should be considered similar to treatment for other chronic illnesses like asthma or diabetes. The condition is something that is treated and managed throughout the individual's life, but it cannot be cured. A range of treatments, including medicines and behavioral therapies, are effective in helping people stop heroin use. It is important to match the best treatment approach to meet the particular needs of each individual patient. Addiction treatment will make individuals more likely to stop using heroin and stay sober. Medically supported detox and withdrawal, behavioral and motivational therapies, family therapy, peer support or 12-step programs, nutritional and exercise programs, experiential therapy. Alright, thank you for listening my representation. And this is the reference